Good morning and welcome to another COVID-19 community update about how the city, county, and our health and educational partners are coming together to fight the coronavirus. We will have several public announcements and comments this morning. The media is encouraged to follow up with any of us individually after the announcements. Maybe I shouldn't have taken my mask off, but I do want you to know I have it here and I am wearing it. This morning, the City of Kerrville is announcing the temporary closing of Louise Hayes Park, Lehman Monroe Park, Guadalupe Park, and Singing Wind Park to any gatherings and celebrations starting at 3 p.m. today through Sunday, April 12. Those citizens can still use the river trail for recreation as long as they adhere to social distancing requirements. The city has already closed the interactive water features, drinking fountains, playgrounds, volleyball courts, basketball courts, tennis courts, and groups of picnic area tables in close proximity to each other to encourage social distancing. Kerrville Shriner Park will also be closed for day use patrons during this Easter weekend, Friday through Sunday. Day use is anticipated to resume on Monday, April 13, but will adhere to new capacity restrictions to avoid any potential for crowding. Kerrville Shriner Park is not accepting camping reservations until further notice. As a reminder, all parks and recreation events and activities are still postponed until further notice, including special event permits and group rentals. We've had a number of questions about Scott Shriner Golf Course, which is anticipated to remain open for play. City staff at the course are taking a number of precautions to ensure that the course meets the guidelines necessary to reduce COVID-19 transmission and to minimize in-person contact with people who are not in the same household. For example, some precautions include the pro shop has restricted access and staff are encouraging social distancing. Group plays with four or less. Fewer tee times are available, and tee times have been adjusted from 10 minutes apart to 15 minutes. Rakes have been removed from all bunkers. Golf carts are sanitized daily and between usage. Golf carts are restricted to single riders, except families from the same household. Debit and credit cards strongly encouraged to limit cash transactions. These park system changes are in accordance with Governor Greg Abbott's executive order for the provision of continued recreational and exercise options, so long as the public is responsible in minimizing in-person contact with people who are not in the same household. Efforts to make sure that everyone in Kerrville who needs food during this crisis time are increasing. The Kerrville Independent School District continues to provide food for students each day, and organizations like Mustard Seed Ministries, Christian Assistance Ministry, St. Vincent de Paul, the Doyle Community Center, the Salvation Army, and the Kerrville Independent School District are all offering food relief options, while Meals on Wheels continues its service to our senior citizens. If you need more information about any of these entities, please call 258-1234. 258-1234 to talk to someone who can direct you accordingly. You can also view an April 7th video on the City of Kerrville's website, Kerrville Clips, to get more information. Once again, I want to thank those citizens and businesses who are using proactive efforts at social distancing. Many, however, are not practicing good habits that maintain health and avoid illness. It only takes one person who is getting sick and not observing social distancing of at least 6 feet and staying in groups of no more than 10 to spread the virus to numerous others. You may think social distancing is silly, but it has slowed or stopped the spread of this virus in countries around the world. Think of your relationships, family and friends. Even if you believe you're invulnerable, think about someone you care about getting the virus because you were not practicing good habits. Think about this. You may be sick, not showing the symptoms. You have an uncle who has a respiratory illness who gets sick, or a niece who has diabetes and gets sick. 28% of infections are person to person. We are pleased to announce that we have no new reported cases of COVID-19 since our community update last week, though in no way that means that we should relax our efforts to contain the virus. I urge all of you to continue doing what you are doing, staying home if at all possible, and venturing out only for essential needs. Working together, we will get through this. I also want to say that at this time, I'm going to turn the podium over to Corey Edmondson, the CEO of Peterson Health.
Thank you, Mayor. Good morning. I'd like to report about the number of cases to make sure that we're all clear on what has transpired in Kerr County, specifically from those patients that Peterson Health has tested. To date, we have tested 144 patients as of yesterday, and we may have one pending at this given point in time. I'm validating that. But overall, there are 3 patients that we have tested positive. And let me clarify that 2 of those 3 live in Kerr County, which you already know about, and 1 is from Bandera County. Peterson Health serves patients from all over the hill country. So we have patients that will come and see us. So it's not always just Kerr County that we are testing on patients. Our drive-in center for testing and screening has been successful. It has gone very smoothly, and we're continue to be thankful for Kerr County and the city for allowing us and making that initiative possible. Overall, at the drive-in clinic, they specifically, and this includes the 144 patients that we have spoken about, but at the testing or screening center, we've tested and screened 88 screened 88 people and tested 69. We typically average about 11 or 12 screenings a day, but that's starting to trickle down, which I consider a good thing. Those hours of operation are Monday through Friday, 9 to 3:30. It's at the Hill Country Youth Event Center. You do need a physician's order still for the screening, and do make an appointment for that. If you're exhibiting signs and symptoms, please continue to communicate with your primary care doctor. You could even call our urgent care center, and we will put you in touch and manage your care at that given point in time. Let's talk about PPE for a little bit. PPE is a new term that some people are like, what is PPE? Of course, in the healthcare world, that's always been a term that we've known, or an acronym. It's personal protective equipment, and you've heard a lot of that in the news of recent because of COVID-19. There's much discussion in the national news about who wears them, when is it appropriate to wear, and is there a shortage in supply? And there is some shortages in supply, but I will tell you that Peterson Health took initiative early on in this process. We ordered supplies, and we feel very comfortable with what we have in stock at this given point in time. It will evolve and we'll continue to order, but we have educated our employees at the at the hospital and out in our outlying clinics about proper ways of donning and doffing, that's putting on and taking off of their PPE, and when it's necessary to wear and under what circumstances. We also put in a new process where we've commingled all the PPE in the hospital, and we are delivering that and according to the needs of the hospital so that we can control the inventory. We can manage our burn rate as to how much we are using as a hospital. We don't want to run short, and if we do run short, we want to know where and why, and then be able to order accordingly. Many questions have been asked about masks, and you are noticing more of that out in the community, and understandably so. That's been a national recommendation. Peterson Health uses masks in the appropriate places and where it's effective to provide barriers. CDC has provided guidelines to the general public and actually has guidelines on homemade masks. Please use their website for more information about that. Community members that you do see wearing masks, really you're seeing that becoming more common. On the CDC website, it talks about wearing cloth face coverings in public and where social distancing measures are difficult to maintain. Example, grocery stores, going to the pharmacy, or wherever. But especially in areas of significant community-based transmission, like in a New York or a Chicago, or even in Houston for that matter. Cloth masks, our coverings are recommended, but they're not surgical masks like what we are wearing at the hospital, or what they call N95 respirators. Those are critical supplies that must continue to be used and reserved for healthcare workers and other medical first responders as recommended by the CDC guidance. Let's talk about social distancing and traveling for a little bit, because Peterson believes that what we're experiencing in Kerr County, the positive piece of we haven't been hit a surge at this point. Peterson Health is ready for a surge, but we feel that the value of social distancing and limited travel is important. The Easter holiday is coming up, and it's ahead of us. And for many of our families, we're used to traveling. It's a traditional time of getting together and all. We personally and my family won't be doing that. We won't be seeing our kids in Dallas. We are staying here in Kerrville and managing that time together, me and my wife. So we're abiding by the president and governors and the mayor's instructions about staying at home. It's more important now than ever that we abide by these instructions. While we've tested positive for 3 patients at Peterson Health, that's really 3 too many. And if you've kept up with the results of those 3, what were they the result of? Is because they did domestic traveling. Nothing was community acquired. That's why we're emphasizing that limited travel and social distancing. We can't afford to put our community at risk at this pivotal peak time. But so here's some encouraging news as a result of that. A few days ago, CDC and other modeling had predicted Texas to be at a peak on May 6th. Just this morning, I was just validating and looking up to see if that was truly still the case. And the good thing is that they've actually moved that to April 24th. That's a positive thing, because I feel like the people are adhering to social distancing, and we're maybe blunting the curve and things are looking good. But let me emphasize that don't let your guard down because of that. Continue to do the things that you're supposed to do as an individual, to be respectful of others. And as I said in the past, it's not about you, it's about others. Be respectful of that. We think it's because of limited travel, social distancing has created some of those positive things, and we'll continue to say that when you're not at work, limit your contact with people outside your household and be proactive in limiting exposure. Safety, a topic I just want to quickly talk about associated with Peterson. You know, COVID-19 has changed all of our lives. For most of us, it's changed the way we think, the way we work, we dramatically altered much of our personal and professional life. And it's forced us all to put new plans in place and new protocols in place and programs, et cetera, and we had to do it really quickly. But let me assure you that Peterson Health has adapted to this change and doing everything in our power to protect our patients, employees, and the community while continuing to meet the healthcare needs of the community. But something hasn't changed at Peterson, and that's the things that are necessary now for COVID-19 we've always had in place and had always been doing at the hospital. We're one of the safest hospitals in the state, if not the nation, based on data that's available. And we were that way well before COVID-19. Zero harm is our mantra, safety is our focus, and we continue to receive high safety ratings. Also cleanliness. We've maybe heard that people are nervous about coming to healthcare facilities and things, and particularly Peterson. Peterson has ranked in the top nationally for cleanliness in the way individuals rate us. And in fact, we were rated in the top 99 percentile or top 1% in the country for cleanliness as an organization. I tell you that to know that your local hospital is very safe and clean, and if you need medical care, feel safe to come to the hospital for that. Community kindness. I'm going to end with this. In closing, that COVID-19 may be infectious, but it can't kill kindness. Talk about Kerrville kindness. Our community has showered us at Peterson with support from encouraging calls, texts, social media posts, and kind donations of food to our frontline staff and even medical supplies for that matter. That love and support energizes our staff each and every day and reminds us how blessed we are to be in healthcare and especially be supported by our community. Your hospital at Peterson, we're going to continue to fulfill our mission to provide exceptional, compassionate, patient-centered care no matter what COVID-19 brings our way. We're all facing a crisis together. We're all standing strong together, and we're elevating health each other, and we will continue to do that as long as it takes. Thank you for continuing to listen to our communication at these events. Mayor.
Next, we have County Judge Rob Kelly. Rob and I have been friends for almost 3 decades, and I've seen in this time his commitment to do the right thing and to get people in this county the help that is needed.
Thank you, Mayor. As you can see, I'm wearing a mask today, but I am in the vulnerable group, as everyone knows, I think. And my wife thought this would be wise, so I'm doing it. As the only lawyer in our leadership team, I thought it appropriate to offer some remarks about the governor's executive order. 10 days ago, he entered that executive order, and there's been a lot of talk about it. But as a public, I'm sure some of you have read it, and for those of you that have, you're probably more confused than before you read it. It is not the clearest, most concise executive order. But I wanted to summarize exactly what it is because there's a robust debate going on out there, sometimes over fence lines, sometimes in the parking lots as to what should and shouldn't be done, what does the order allow and not allow. So let me just summarize what it says. It says that on a statewide basis, every person shall, and that makes it mandatory when the governor uses the word shall. But here's what you're ordered to do. Number 1, minimize social gatherings and minimize person-to-person contacts with others who are not in your household. That's what the command is. You shall minimize personal contacts. Except, and it's the exception that's causing the debate, except where necessary to provide or obtain essential services. And the definition of essential services goes all the way back to Homeland Security. You can go to the TDM website, which is the Texas Division of Emergency Management, to find out what essential services are. And that's being very hotly debated out there on the streets as we speak. Now, what's the takeaway that you, as a citizen, should take from this order? I want to emphasize 5 major words. The first one, minimize. That's what we've been ordered to do. Minimize personal contacts. And use your own judgment on that. There's no standard in this order telling us what minimize means. So you have to use your own personal judgment to minimize those contacts. The second thing it says is that whatever you're about to do, whether you're leaving home, you're going to go to work, Is it necessary? Necessary is the second word everybody needs to focus on. The third is the word essential. There is this definition of essential services that I told you about. But what it also means is that you are to minimize your personal contacts in those essential services. There are also non-essentials out there. Let me give you an example of what concerns me at this point. If you look at the traffic out on the streets, I don't know how many of you are staying at home. I can't estimate that percentage. But I can look at the traffic. And the sheriff and our emergency management coordinator have looked at this. And as best we can tell, the traffic looks like it's down about 25 to 30%. Well, folks, all of the medical literature right now show that if you can reduce your social distancing by 50%, if you can pick social distance at least 50%, the risk associated with this virus decrease significantly. And so my goal is to try to get that traffic in the county down from 75% to the 50% level. And so think about, is it essential to be out there? Whether you're going to Walmart or H-E-B or wherever it is you're going, is it necessary and is it essential? Now there's two other words that I want to emphasize here in this order. The social distancing really means isolate. We need to isolate ourselves as much as possible in our households. And the fifth word, the last word I want to emphasize here, is responsibility. Exercising personal responsibility. And I want to close with an anecdote about my father. As I told you at the beginning, I am a lawyer. And many years ago, when I passed the bar and was a briefing attorney at the Court of Criminal Appeals in Austin, they had a special swearing-in ceremony. My family came. And afterwards, my mom's taking photographs, and my dad leans over to me and whispers in my ear, "Now that you've got your license to steal, son, let me give you a piece of advice. In this world, sometimes there's a difference between what's legal and what's right. And if you ever have to choose what's right. In this crisis, you know what is right. Please, be safe, be smart, and remember these 5 words." Thank you.
Dr. Mark Faust is next. He's superintendent of schools here at KISD and has had to deal with incredible numbers of changes in response to the COVID-19 crisis. And we hear him gladly.
Thank you, Mayor Blackburn. And I would say how incredibly impressed I am with our staff. Our teachers are doing incredible work to create engaging lessons for our students. We've heard stories over the last few days, this first week and change of virtual KISD, of students with their laptops doing PE exercises and videoing themselves in the driveway, and just the different learning experiences that our students are able to have in this amazingly fast transition to virtual KISD. We're really inspired by the work that our teachers and our faculty and staff are engaging in for our kids' sake. And I'll say more about virtual KISD in just a moment. Our community grab and go meal program has been very successful. We did condense this week to Tally, Nimitz, Daniels, and elementaries in our early childhood center. We have served to date, by the end of today, more than 20,000 meals to our community. I want to let our community know that we do have the community feed program tomorrow. Even though tomorrow is a school holiday, as Good Friday, we will provide the food service, the grab and go meal service tomorrow. I'll also mention that Monday we had on our school calendar, our district calendar, as a bad weather or school outage makeup day. That will be a regular virtual KISD day. So Monday the 13th is a school day for our students, albeit on virtual KISD. But please access that. We encourage folks, if they have students in their house 0 to 18, you do not have to be a KISD student. We encourage you to access our breakfast and lunch opportunities. You can get breakfast and lunch in the mornings from 7 to 9 and lunch from 11 to 1 at those 4 locations. I also want to say that next week we'll have guidance for our families, for our students and our parents on some changes to our grading practices. I can preview that we're going to go to a pass, fail, or incomplete system for all of our grade levels, but the nuances and details, we're still trying to make sure that we iron those out, and that's clean and clear for our community. So we'll have some communication at some point next week on changes to our grading practices. We are watching the calendar very closely. We're still not in a position to be able to say whether or not we'll be back in school after the governor's order lifts on May 4th. We're not even certain that the governor's order will lift. So we're watching every piece of information we can from the State Department of Health Services and from all of our federal and state partners there. And we're really hopeful that we can get back into schools and finish out this school year. I do want to say a personal note, my heart goes out to our seniors at Tybee High School. I know that this is gut-wrenching, that they're missing out on some experiences, and we're going to work very closely. Ms. Balzer and the leadership team at Tybee are going to do everything we can to find a way to get those experiences in somehow at some point. So we just ask for them to hang on with us. And I'll close by saying the virtual KISD we've rapidly made the transition, but we will continue to modify and adjust as we get feedback from our customers, which are our students and our parents. We take learning very seriously in KISD. We do not want learning gaps for our students, and that's why, as I said initially and I'll say today, we are aggressively pursuing our kids to provide them with opportunities and to have them take those opportunities, produce work, and send that back to us just about any way we possibly can, so we can continue the learning process these last 7 weeks of school. I would also close by saying we ask for patience and grace. Our teachers have a high level of stress because they care and they want quality for our kids. We know that parents and students also have a high level of stress because they want to do the right thing. They want to support and serve their students, and they want to make sure they have good learning opportunities. So we ask that everyone sustain that patience and that grace for one another for the remainder of this time that we're in virtual KISD. We can't say how long that is, but we're asking for sustained patience. So please work with our staff, communicate with us, and we will be responsive to questions and concerns. Also, we want to ask for continued vigilance. We stand with these other community leaders, and KISD says we cannot let our guard down. Even if the data begins to turn and it looks favorable, we have to continue to be vigilant and careful, take this social distancing very seriously, and follow the guidance of the CDC with the hand washing and all of the safety or health precautions. We have to stand firm there, and we cannot let our guard down too soon. The pathway to getting back to some sense of normalcy, to getting back in the classrooms, is by being methodical and following the guidance. It's not by making quick decisions too early. So thank you for your continued support of our students in this community, of our parents who are becoming their children's teachers, and they didn't plan for that, and for our staff who are working incredibly hard to produce quality learning experiences. We appreciate your support of KISD. Thank you.
Next, Dr. Charlie McCormick, who is president of Schreiner University. And one of the things I love about Schreiner, they're very community oriented, and they are in partnership with most of the folks up here in different projects. So Charlie, we hear you gladly.
Thank you, Mr. Mayor. So Schreiner University, in order to mitigate the spread of COVID-19 in the counties where we have campuses, Kerr, Cameron, and El Paso counties, are in alignment with guidance from the CDC, federal government, state, and local governments of Texas. And we've transitioned to online instruction as of March 23rd, and will offer virtual learning experiences, both curricular and co-curricular, as well as virtual academic support for the remainder of the spring semester. To comply with federal and state guidance, only essential personnel who are responsible for security, technology, and other crucial operations are now operating on our campuses in Kerrville, Brownsville, and El Paso. And all departments whose function is independent of physical location are required to work from home. Our priority since the beginning of this crisis has always been the health, safety, and well-being of our students and employees, as well as that of our communities. A second priority has been to provide a premier educational experience to our students, and using the latest guidelines and information available, Shriner's emergency response team has taken numerous steps to ensure we fulfill these priorities. In addition to standing up the virtual learning environment and sending all but essential employees home, beginning March 26, we begin the first of several employee reassignments across campus as we live into the reality of temporarily being a non-residential campus. It's our ongoing goal to maintain as many positions as possible across campus. All public events on campus have been canceled through the 1st of May, and we continue to examine all events on an 8-week sliding window. Residence halls and apartments on campus are closed. All residents have been vacated with the exception of a very few with extenuating circumstances, and for some staff whose home is the campus. All university-sponsored travel has been suspended until further notice, and access to university buildings is limited. Access to campus is restricted to authorized personnel and approved vendors. Campus visits and tours for admissions purposes have been suspended, and a virtual campus tour is now on our Shriner website. Shriner University technology is helping fight COVID-19 by lending computational power that we're not currently using to a national effort. And we continue to collaborate closely with the City of Kerrville, Kerr County, local health departments, local school districts, and Peterson Health to monitor further developments. Shriner University will update its website if changes to university operations occur. And know that your Shriner University looks forward to having all of you back on campus soon and after this crisis has passed.
Next, Gil Salinas comes to give us a perspective on some economic developments. He is the Executive Director of the Kerr Economic Development Corporation.
Thank you, Mayor. Good morning. At the Kerr Economic Development Corporation, we're currently assessing the economic situation as it pertains to local industry, cluster development, supply chain, logistics, and its network of supporting businesses. We've been working with the Office of the Governor in conducting an inventory of local and regional businesses affected by the coronavirus. We're currently crunching that data, and it should not be a surprise that the numbers do not look good. However, we are happy to report that Kerrville, Kerr County, is doing better than the state and as well as the national average. Our unemployment rate will spike without a doubt. The state has already reported that there has been a 1.5% spike as of this week. Now, that's not reflective of the situation that we're in. It'll be until next month that we'll see the true picture of what the disaster is really gonna cost us as far as job-wise, because these numbers typically are 1 month out. In Kerrville, there's quite a few businesses that are still operating, either curbside service or by appointment. We've had a few closures, and typically those are the ones that cannot operate via social distancing. So we are hopeful that they will be able to rebound. Now, about access to assistance. We have created a business resource toolbox at kerredc.com, where there's a list of programs available for any and basically all kinds of businesses here in the area. Again, that is at kerredc.com. We have been in direct communication with our counterparts in Austin, as well as those in Washington, D.C., specifically with the EDA, that's the Economic Development Administration, as well as the IEDC, that's the International Economic Development Council. And what we're hearing from them is to basically, in a nutshell, they said apply. Tell your local businesses to apply to as many programs as possible for as much as they can. There's nearly $3 trillion that's being made available through a combination of stimulus funds, loans, grants, and basically for any kind of operation. Small businesses, private nonprofits are perfect candidates for these funds. This money could be used either for debts that you might have, payroll, accounts payable, and other bills that were affected by this disaster. There's loans of up to $2 million. With no payment for the next 12 months. There's programs with repayments of up to 30 years. So I'm not gonna say that this is a once in a lifetime, but it's pretty close to it. There's also some forgivable loans where if you keep employees for a certain amount of time, that loan will eventually turn into a grant. You can also log on to the Chamber of Commerce, Kerrville CVB. KPUB also has some information on their website, as well as a Kerr EDC website. We'll have that information out there at your disposition. Now, to simplify things, next week you're going to be seeing a Kerrville Together Awareness Initiative, which is basically going to be a portal of information. It's a website that's going to have information on what's open, what's not, and what you can do to support local business, local trade, local industry, also how to support our academia and support our creative sector, and also, most importantly, our frontline workers. I'll leave you with this. We as a community, we need to ensure that Main Street USA in Kerrville, Texas stays alive. We need to engage a made in Kerrville mentality. Those of us who work in some larger businesses or own a larger operation, if you have a budget, it's as simple as just order some lunch once a week for some of your workers or whoever works in your department. Our businesses would greatly appreciate that. Resist the urge of going online and call up one of the local shops, one of our local suppliers, if you're going to be ordering supplies for your office or for your businesses. Partner with some of your other departments or your other businesses to get this made in Kerrville by Kerrville mentality going. And the easiest way for every single person in this community, in this county of 50,000 to make a difference is, just imagine if just today you were able to buy a $25 gift certificate from one of our local businesses. That would go a long way, and it would be greatly appreciated by our local entrepreneurs. Again, let's do our part to support our local business, our local industry, as well as entrepreneurs. And it's only together that we're gonna succeed, and together we are gonna overcome. Thank you.
Our last speaker is Mark McDaniel, City Manager of Kerrville. Mark came to us from being Assistant City Manager in Dallas, where he helped that city respond to the Ebola crisis.
Thank you, Mayor. I'll be very brief this morning, mostly reinforcing some of the things that have already been said, but I think these things need to be reinforced. First of all, I want to thank the community and the way that they have responded to this. This is probably my 12th or 13th crisis as far as a natural disaster or emergency to manage through as a city, but it's very, very different. And I'm so happy to have the team that we have around us in this community as far as leadership and our employees to work through it. On the staff level, I couldn't thank the chief enough. Chief Danny Smith and his department, they're on the front lines. They're encountering people on the street every day, as well as our police officers, people that don't live here necessarily, that are coming here from all parts of the Hill Country and beyond. Some of them to get away from where they are, but they're protecting us and watching things and keeping an eye on Kerrville, and I really appreciate the work that they're doing. The mayor mentioned the parks will be closing for this busy Easter weekend. Easter weekend is our second busiest day or weekend in the park. And so we are taking precautions to help people with that social distancing. I think it's been articulated very well, the importance of that. And we have people here coming from other places, and it's just the best way to deal with the potential of the spread of the virus by limiting the gatherings. On the golf courses, the mayor mentioned all the precautions that are taking place. As you all know, we have 3 18-hole courses here in Kerrville that are very good courses. People like to play those courses. I'm happy that River Hill has done the right thing in terms of limiting their play to members only. The city's taking precautions in terms of spreading out, limiting their tee times. We are still examining the courses. At some point, we may have to close those courses, but right now they're still open, at least through this weekend, and again, we're evaluating that. Now I want to turn a little bit to restoration, and you heard Gil Salinas talk about the services that are available for businesses through the federal government in particular. we are focused on that. We're looking 2, 3, 4, 5, 6 months down the road. All of these gentlemen here are doing that per our conversation this morning. So for us as a city, short term, that means we've got some significant budget impacts. And so we've been examining that for at least the last 4 to 6 weeks in greater detail. Tuesday, we'll make a report to the council about what our strategy is, and it's a pretty big number. And the thing about city government, as well as any government, is there's money, but you can't spend it on just anything. It's only allowed to be used on certain things. So it's a bit of a puzzle to put together, but this is not the first time that we've encountered this, but it's going to be pretty significant, and we're anticipating some significant losses in revenue, particularly sales tax and hotel occupancy tax. So again, more detail on that on Tuesday. And the last thing I'll say is, going forward, this group will attempt to not meet in this format. We'll do an electronic briefing just because of us wanting to set the example and also limit exposures. So next time you hear from this group, it'll probably be in an electronic format. Thank you.
In spite of the difficulty and changes, I hope you have an excellent Easter weekend. Thank you.